Welcome to Sick Care is Dead. I'm Brittany Sigler. I'm a product leader trained as a doctor of public health, and my favorite thing is working with founders to leverage the latest technology to make it easier to be healthy. And from where I stand, that means going upstream before people are sick and scaling to as many people as possible. We think there's a lot to say, and this is an amazing group of clinician founders and operators who are really at the cusp of where this space is going, and who I love personally getting to speak to hear what they have to say, so I'm glad to share that with all of you. And before we jump in, from Alina.
Hi everyone, what a group of beautiful people. Give yourselves a round of applause for coming at 10 a.m. on a Tuesday to learn about the future of healthcare.
All right, so let's jump in. The traditional healthcare ecosystem is undergoing a massive architectural shift. The doctor's office is no longer the default entry point to care. GLPs are prescribed over text, consumers are ordering blood panels themselves, Gen AI is first-line triage, but we're building a brand new consumer health stack. And as we step outside clinical institutions, we have to look closely at these mechanics. How are we going to move beyond the superficial tracking into true proactive health intelligence? How do we scale behavior change to millions of members? And what happens to trust and clinical validation when health becomes consumer-driven? So I'm excited to hear from these 5 incredible clinician founders. And let's hear what it means to them. So Sick Care is Dead. Let's make that concrete. Tell us about who you are, what you're building, and your personal thesis about where prevention actually happens now and why it isn't the doctor's office.
Okay, all right. My name is Royan Kamyar. I'm a physician by training and serial entrepreneur. My company is Owaves, my body clock. And our thesis on prevention is really built around lifestyle medicine. So really following Dean Ornish and American College of Lifestyle Medicine, 5 main ingredients for a long, healthy life: relationships, nutrition, stress management, sleep, and exercise. And our insights is that they all share a common denominator, which is time, hours and minutes. So we think the calendar or day planner, should be the de jure tool for positive lifestyle change, and then really optimizing the timing of those activities according to your personal circadian rhythm. So that's what we're working on.
Yeah, it's Dr. Sohaib, and I started with Owaves. I met Royan 7-8 years ago, and that inspired me to board certify in lifestyle medicine, which is all about prevention. Currently, I'm Chief Medical Officer at People Inc., which owns Verywell Health, Health.com, InStyle, Birdie, Eating Well, 20 different brands. And we believe prevention is through health communications. So as you see, most people are getting health information through ChatGPT or TikTok. So a lot of our content is physician reviewed, and we think behavior change happens when you can engage the end user or the patient. So communication is key, and the way you do it is competing with Netflix, is competing with other companies. So communication is a key pillar of what we believe in at People Inc. Thanks.
Hi, I'm Dr. Erin Nance. I am a board-certified orthopedic surgeon, still practicing. I am also a medical social media influencer with about 1 million followers and 400 million viewed videos, all about medical education, no singing and dancing on my part. I am the founder of Takeaway MD. It is the first physician-run social media network, and I believe that prevention does not happen in the doctor's office. Right? Prevention happens in the 99.9% of your lives when you are talking with your community, when you are talking online, and I echo the point about communication. And so I really feel it's more about how can we help you help yourselves.
Hi everyone, I'm Dr. Hillary Lynn. I started my career in primary care in a traditional setting at Stanford and really built what I'm working on now, CareCore, out of my own observations. Similar to Dr. Erin here, I also work a lot on social media. I believe communication is key, and my mission with CareCore is to make healthcare as easy to access as a link in bio, but as protected as any sort of clinically governed system.
Awesome, and I'm Alina Zolotareva. I'm a clinical dietitian by training, so an RDN. Was very disillusioned with the world of healthcare in my undergrad. I was pre-med, and while working in the hospital, I was always being told, like, food is medicine, exercise is medicine, recovery is medicine, lifestyle medicine works, can prevent 70%, 80% of our chronic diseases are preventable upstream, but it wasn't actually happening in practice. And so I became super, super disillusioned and went into the wild world of startups for the last 15 years. And most recently, I'm the co-founder and chief marketing officer of a company called VO Health. And what we're doing, my co-founder is an MD, PhD scientist, Yale trained, NIH trained. And what we're creating is the new biomarker toolkit for prevention and proactive healthcare. Today, we're measuring biomarkers that are lagging indicators of health. They are, by the time your hemoglobin A1C is high, etc., the disease process has already started. And so what we care about are measuring, creating the scalable tools to measure what actually matters: cardiorespiratory fitness, body composition, insulin sensitivity, metabolic health. Today we don't have the toolkit to actually trigger exercise interventions and lifestyle interventions. So that's what we are passionate about.
Thank you. So a lot of you mentioned, or you all have this in common, you started as clinicians before you became founders. You were practicing, you were seeing patients, and all of you have the shared goal of wanting your patients to be healthy, but that wasn't working. Something had to change. And at what point did you notice that you weren't able to drive that sustainable behavior change within the clinical system? And what do most founders who might not have the same background as you not understand about what it takes to drive that sustainable behavior change? And how are you bringing that to your companies?
I think it's very clear that clinical care today, especially traditional insurance-gated care, is simply not enough. You have maybe 5-15 minutes with a doctor once a year, and now healthcare is happening all around us. It's continuous, happening in millions of data points all across our lives. And so I realized that we need to shift our entire understanding of even how healthcare is conducted in order to offer the best form of prevention and also the behavior change focused care. We all know that that is actually the hardest part, behavior change.
I guess, my story is I come from a family of physicians, and so I always knew there was something ironic about the physician lifestyle, but then when I experienced it myself as a medical engineer at St. Vincent's, Greenwich Village, downtown hospital, RIP, I actually had a lecture there from the chair of our internal medicine department, and it was the top floor of the hospital. This is in 2007, and he was lecturing us on how heart disease was still the #1 killer in the United States, and that sedentary behavior and poor diet were major contributing factors. We were being asked to sit there for 4 hours straight, no breaks, and being fed pepperoni pizza and sugary soda as our lunch. So the irony was way too thick, and I knew the change wasn't happening, at least at that time, within the 4 walls of the hospital. So my passion was to get out, and when I saw what Fitbit was doing, the App Store came out, I knew and the Health IT Act, the Health Tech Act, 2008, 2009, High Tech Act. I knew that there was going to be massive change, and I wanted to be part of it. So.
Yeah, I would say Royan was pretty inspiring for me. So when I was doing my clinical training, I saw in the hospital, doing night shifts, being sleep deprived, a lot of stress. And physicians weren't people who were trained in preventive medicine, medical school. I think everyone's heard the training when it comes to nutrition, exercise just isn't there. And I think, Royan, you talked a lot about lifestyle medicine. So that's actually one of the first places I learned about lifestyle medicine and what Owaves was doing. And then also, I was at business school for a year, and I learned how quickly technology was taking over the consumer space, and why was it so much easier to send a selfie to your friend through Snapchat than get your health records across, which needed a fax machine. So I think that point I realized healthcare was kind of broken, and there was an opportunity for prevention and technology to kind of come together to really accelerate where we are today.
And I'll just say this, information and data may change your mind, but community is what changes behavior. And we really need to lean into creating the infrastructure. So at Takeaway MD, we are pioneering the science of belonging, because we know that isolationism and feeling alone are probably worse health indicators than a lot of the biomarkers that we are measuring on our Oura Ring and our Whoop. And so we need to really start to think about how can we build out the infrastructure of bringing people together.
That's great. I'm going to skip to another question that really relates to what you're saying, that when we talk about behavior change, it's both internal and external. And when we're looking at technologies, at digital products, that tends to only be one side of the coin. When we need to build those systems, it's about our personal health and our biometrics, about our interpersonal health, how we relate to one another, and the environment around us. And to do that, we need to connect the dots between what's happening within the product and, to Erin's point, within the community. And I think a lot of that is anchored in building trust. And I think that's challenging with digital products, that when you're within clinical institutions, you have this brand name on the door, that you know that a patient is coming and they assume that they're gonna, it's not even an assumption, it's an expectation that whoever is working within these four walls is gonna take care of us. How do you build that trust at scale in digital products or outside of there? If we're going upstream, how can we build that sense of community and trust?
Coming at it from a media perspective, at Verywell Health, we ensure kind of physicians are in the loop. So board certified physicians, we have 140, review all our content. So I think a lot of the signals, there's a lot of misinformation on social media these days. So important to have trust, especially as a founder, if you have a startup, is to have physicians on your team because they bring the credibility, or healthcare professionals generally with domain expertise. I think nowadays it's super hard to try and, with AI, understand kind of what's fake and what's real. That's another challenge we've been facing. But what we found is that our brands, because they've become credible over time, still hold that gravitas. But still, if you look at Google search, Mayo Clinic and Cleveland Clinic, because of their reputation, they rank very highly on Google. So it's really interesting for kind of a startup that's starting off, maybe B2C, how they establish that trust. And it is a challenge of today.
And I think you have to understand how the trust is being developed, right? And I find myself in my own startup thinking about this. If I am bringing on Mayo Clinic as an institutional partner, I am borrowing their trust. I am not doing anything to earn that trust my own. That trust is developed over individual interactions. And so, I think bringing on, clinicians and other medical experts is very important, but your product has to be the one to build the trust.
85% of people state that their primary source of health information is from social media. And I really built CareCore out of the mission to meet people where they are. And while there's a lot of antagonism and I think friction with accepting new ways of communication, a lot of doctors don't love social media. A lot of doctors don't love even telemedicine. It's medical field is an extremely conservative field by nature, but I believe that you've got to meet people where they are. People do trust their favorite influencers, and they love medfluencers. That's why many of us here, we've built a content brand as well. And so I believe that it's all about making sure people who do have voices have the right information or are communicating scientific, evidence-based information. And so what we're building, and I believe that's what everyone else is building around, is building evidence guardrailed communication sources so that we can continue to earn people's trust.
I think the sentence of meeting people where they are is, one we've heard. I think all of us have been in this space for quite some time. 12 years ago, I was working on a text-based intervention before Gen AI, was a thing, and we had to manually craft the messages that were going out based on the decision tree logic, and we were using the same sentence. We want to meet people where they are. But I think the definition of that has really changed in terms of personalizing care. And before is you could maybe have 4 cohorts that you were targeting, but if you were in the same cohort, you're going to have the exact same care. And if I was meeting you where you are, you're exactly the same as someone else in your cohort. That's no longer the case. With Gen AI, it's now possible to be truly personalized, or really, I've been hearing the phrase, truly individualize these N of 1 experiences based on this plethora of data that we're going to collect both about you and in context. And I think this creates both signal and noise, that in this world of data, how can we target those experiences to make it what you need to experience? What We can send these timely, just in time messages. We have these dashboards. We have these, new wearables with new sources of data. What is actually valuable with all of this data to actually make it what a user, a consumer, a person needs to be healthy? And how do you separate that? How do you decide what you're paying attention to with what you're bringing into your product? And how do you deliver that to your end user?
I think the way that I'll answer this question is that on the one hand, I think that the current sort of data and biomarker revolution that we're living through is really, really awesome. Like, who here has done like Function Health or Superpower or measured all of their biomarkers recently? Okay, so a good number of us have done that. And have you found value in it? For the most part, yeah. What's really cool, I think that what Function Health and companies like that are tackling is the shortcomings that are in our traditional healthcare system. So I went to my PCP recently. I complained of fatigue. She didn't even run an iron panel, and I'm iron deficient. So just to give you guys a sense, we're missing a lot in our traditional healthcare system. Function Health closes a lot of those gaps, but do we really need to be measuring every single biomarker that exists at Quest or LabCorp? No. Our thesis at VO Health is actually that there are a few measurements that really actually matter for real-time functional health and functional capacity. It's in the way that we're defining health, that's where we're missing the boat. So our understanding and our belief is that health should be defined by human function and human performance. So for us, our toolkit that we're building is based on the tried and true measurements that actually matter. So cardiorespiratory fitness, or VO2 max. Have you guys heard of VO2 max before? Body composition, how much skeletal muscle we have, how much visceral fat we have, what our bone density is, and things like metabolic health. So those are 3 things that are currently not being measured at any PCP office that I know. And that toolkit needs to be scalable, it needs to be easy. We can't have folks running on a treadmill, at every doctor's office and every doctor's visit that they do, even though some amazing longevity clinics like UNARA, as an example, do offer such tests and DEXA scans. But our belief is that in order to actually create the system that's going to drive long-term health at scale, we need better tools. So we're developing omics-based blood tests of functional capacity measurements in order to do so.
So I think this is probably the most important question, like the question of our time really, is like, how does AI serve us rather than distract us or make our lives worse? I think we saw what happened with social media when things go wrong and the algorithms are not working in our favor. So I think clinicians have to be behind the wheel for these healthcare solutions that are the next generation that are coming out, leveraging AI technology. And to see how we steer it, I'd really listen to the people that are leading the generation of these models, people like Demis Hassabis. And there's a lot of documentaries. He's kind of on a speaking tour, trying to make AI look a little more human and more sensitive to human needs. And if you talk about how they came up with DeepMind and AlphaGo, they start off with video games. And does anyone know the reason why? Has anyone watched the documentaries? Or please do. And the reason is because video games have a very objective and clean high score metric that the algorithm can optimize for. And it eventually can start playing against itself, and it knows if it's winning or doing well because that score, that objective black and white score, keeps going up. So now if you translate this to humans, it becomes very difficult. Are we optimizing for BMI? Is that the definition of a good life, right? And it almost gets philosophical, like what North Star metric do you optimize for? And is that going to be the same as the person sitting next to you? And how does that change? I know that the North Star metric I would have chosen in my 20s is much different than the one that I would choose now. And so that algorithm needs to grow with you too. And so I do think this is a very important, critical question. And I think ultimately it should be individual.
Yeah, I just want to your point, I don't think we need more biomarkers. I don't think we need more dashboards. I think we need better interpretation, better wisdom, better judgment, and better empathy, which are all human skills. And I think the next, real revolution is not going to be a technological one, but a philosophical one about what are we doing to make us better humans.
I actually have a counterpoint. I love that. I love that. But I also want to state out loud that when I think, as a repeat founder in health tech, when I think about what's actually moving this field forward, it's so much more than healthcare, even the science, which I think is amazing. We're about to see some truly nutty things over the next decade, so hang in there. But I actually know, and perhaps it's because my co-founder is an AI scientist, that the technology and the innovation happening in that sector is moving far faster, and it's moving all of our industries. So that being said, what feels overwhelming today is quickly becoming discernible. So with agentic AI, with all these systems that are just at our fingertips even today, not to mention in like the next few months, we actually are seeing massive improvements in people being able to discern meaning and signal from data themselves. So what used to be so frustrating, the distributed nature, the fragmented nature of all of this data and information in healthcare, having to go to like 100 different offices to get what you want, that's about to become a lot easier, and it's due to the technological innovations. So if that's what we pay attention to, I believe very strongly in sort of confronting really uncomfortable truths in the industry. And another one, for example, is I mentioned the thought of clinical visits. The solution isn't to like clone concierge longevity doctors and have clinics all over the universe. You have to think about healthcare completely differently, and flipping it on its head, healthcare being a surface, a layer on top of everyday life, is how I think of the future of where we're going.
I want to switch gears a little bit based on something you said about having a single health score, which I think is a huge challenge in health. I know we're seeing a lot of scores these days, and if you have a wearable, you wake up and check many scores. I'm an Aura wearer, I have at least 4, but there's not one. And actually, when I was doing my doctorate research, one of my leading questions was how do we get more investors to pay attention to health? What would make them interested in allocating their capital to products that improve consumer health? And I spoke to product leaders at consumer tech companies, and I spoke to investors who are not healthcare investors. So I think this is what this is all about, is going outside of the healthcare system. And something that came up, and one of the biggest challenges and barriers to that, is there is no such metric for health. A lot of people try to make an analogy to ESG and what has happened in the environmental health space, and you book a trip on Google Flights, you'll see the emissions saved. And this emissions saved, if you make a certain choice, is now visible. And you can make the impact and the positive externalities of your choice visible. That it's much harder to do in health when there is not one single score. And it's hard to socialize that. And across all of these companies, part of that is patient education or end user education. They're not patients yet, but there are users. And how do you know that there is value? Oftentimes it takes months, and that's another big challenge in health, that we know that I'm sure all of you know this too. If you've tried to improve your own health or behaviors, you're not seeing improvement on the matter of fiscal quarters. It takes much longer to see improvement in your health outcomes. So when we're trying to align with investors and just success as a business, relating to economics, how can you be successful? Customer acquisition costs are high, especially when you're combating against e-commerce or CPG companies that might not have regulatory constraints that are present in the healthcare sector. You're competing against pharma ad spend, which is ginormous, and they're saying that medication is the answer to solving these health problems. How do you approach the question of economics and solving consumer health as a viable business model?
This is a really hard question to solve, and I am going to have my one hot take, which is not going to work for everyone, which is I believe strongly in not playing legacy games. And legacy games are trying to serve payers, for example, today, third-party payers, insurance companies. Anyone who works in this space knows that billing codes, diagnosis codes, they're so outdated. They don't fit our understanding today scientifically of what health, especially preventative health, are. And so if anyone's a founder in that space trying to get your thing insurance reimbursed, I'm sorry that this answer is going to be really hard. But also I would ignore the investors who care about that if you are truly building for a lasting, sustainable company for the future. The consumerization of healthcare isn't a debate. It's already here, and I believe strongly that we're going to continue seeing the disintegration of insurance-gated healthcare as we keep going. And so I believe strongly in the scientific evidence behind each of our movements. I agree with you, it's really hard. There's no one single score. But everyone from doctors to consumers are getting much smarter, much savvier. I do user interviews. I see people, they browse our website, and then they've got Claude open in another window. People are really smart, and with AI improving all the time, people are able to understand a sleep score is not the only thing. Health is holistic.
Now, when it comes to scores, biological age tests vary a lot. The science there is still kind of coming on. I use a lot of different wearables, and I see the data vary between my Whoop, my Aura, and now my Google Fit as well. I've got Ultra Human on the way, so I use this as a bit of a proxy of where I'm at, but I don't go off all the data points because the algorithms are designed to be gamified, so you do see progress, and therefore you follow those behaviors. So if you look at behavioral economics, we know, for example, loss aversion works better than gain. So I think the future of health needs to be designed in a way where prevention is rewarded, but also, there's models in Singapore where they paid the population to do healthy behaviors to bring down the premiums. So maybe that's kind of the first step, engaging with health insurance, because I don't know how it's great to get rid of health insurance, but I come from England where healthcare is free. So coming to the US, there's quite a difference. You don't know what you're going to get in the ER. For example, I went with my daughter to plastic surgeon the other day. She needed stitches on her top lip, and it cost $2.5K. In England, that just wouldn't happen. So I think the medical system is set up in a way which doesn't incentivize prevention, but now consumer health companies, for example, Whoop now has launched telehealth visits. We're seeing Aura do similar with Council Health. There's a lot of change where consumers are getting closer to healthcare themselves, and as Hillary said, understanding their own biomarkers. But I think it has to be optimized for you. I was talking to a dermatologist, for example. If you run a lot of marathons and you're a woman and you're mid-age, we know cortisol spikes, that causes skin aging. So you're optimizing for your VO2 max or for your skin health. So I think you have to be very clear on what your goals are, because at times these goals are odds with each other of human performance and just living longer. So define longevity, define your goals, and I think physicians need to be kind of reimbursed for that.
But just to give you a little bit of the actual economics, I'm not going to name the telehealth company, but they are paying their physicians $4 per answered text message. Okay? What board-certified physician is going to, these companies are being propped up by investors. Okay, they're not being actually propped up by the reimbursement economics. And we've seen a lot of these companies, they've already made the shift from having MDs cover the visits to NPs to cover the visits. Who's next? It's going to be the AI agent covering the visits, all right? Let's be honest. So this is an impossible question to answer about how to fix the economy, but that was just a metric that blew my mind when I found out how much people were actually getting reimbursed to do this work.
So to that point, I think I'm just skipping around based on what you're saying. But so what has to stay human? So when we say it's easier to have one of these businesses and create access to care if it's an agent, and we know we're not treating clinicians to their full top of license value. In the consumer health stack, what stays human and what goes to AI?
From our perspective, our thesis, and I think the thesis of all of us, the understanding is that exercise is medicine, diet is medicine, community is medicine, recovery, rest, sleep, good sleep are medicine, all the pillars of lifestyle medicine. AI is never going to take you outside, it's not going to get you to go outside and exercise, right? But what will? Belonging to a great gym, a great fitness community, right? I was just at High Rocks yesterday, seeing 50,000 people run a High Rocks race with their partners. It's the biggest fitness event in the world, bigger than the New York Marathon. And it's been booming and growing in popularity at the same time as AI has been adopted. And why is that? Because all of us are craving real human interaction, real physical effort, and that stimulus is what we need to actually receive the benefits of the longevity benefits, the prevention benefits that exercise brings. Same thing with diet. You need to eat the food. We must ingest the food into our bodies to receive the benefits, the nutritional benefits of said food. And so I think for what we're working on, we really believe that the future, since this is called sick care is dead, where is healthcare? It doesn't only live in the doctor's office. It lives at home, to Hillary's point. It lives at the gym. Right? It lives in your neighborhood, run club. That is prevention, that is proactive healthcare at the core. And so without that, no matter what a physician tells you, no matter what AI tells you, it's not going to matter.
I still see patients, and yesterday I had an amazing first patient visit with somebody who's an engineer, really smart, came to me with results from their function health panel and CAC scan and so forth. And so he had all the information. He was a very smart person, and he just said to me that it was so nice to talk it over with a doctor. And that really pointed out, I'm all for AI and scalability and access, and I believe so strongly in that. But there is a portion of us that still wants a human being to relate to when talking through something difficult, confusing, and related to something so important as health. So I agree that we've got to keep a human somewhere in it. It's not the right solution for everything. I don't think we should be using, doctors' times for answering $4 text messages at all. That's the wrong way to think about it. We should allow AI to take over that sort of care, the transactional parts. Instead, we should save the human relationships for things that really require a human connection.
And I just want to suggest one more thing that I would like to see, going through the medical training system, is that maybe clinicians should embody health and good health and what it means to be a healthy person. I think if let's say a lot of the more logistical kind of calculations get offloaded to a computer, maybe we serve as inspirational figures in our patients' lives. They can look to us as examples of what it means to take care of yourself and your family and achieve your professional goals. I just think that it would be inspiring if the people who are delivering healthcare are actually healthy people.
Part of when I started Takeaway MD is the first wave is this medical content engine. But when I actually listened to what the users wanted, they just wanted to be connected to one another. Because if you're a woman with endometriosis, there is no one you trust more than another woman with endometriosis. And I laugh because I was doing some deep market research, and as a hand surgeon, I kind of infiltrated this carpal tunnel Facebook group, and I was reading all the comments and seeing them, and finally someone said laser beams are the answer, and I had to out myself. I was like, guys, I'm an actual hand surgeon, and I promise you, laser beams are not the answer. But they didn't want to listen to me. They wanted to listen to each other. And so that's kind of one of the scary parts is, community without guardrails can sometimes be problematic. And that's what we're seeing. I tell people, I think a lot of the answers are hiding in plain sight. They're hiding in Reddit threads. They're hiding in Facebook community groups. But you do need someone to kind of take a, step back and say, okay, what exactly is the information? Where is it coming from? What is the source? And so I think enabling community while also having, these guardrails of these medical professionals is really the combination that we need.
I just really quickly wanted to touch on something that Royan said earlier. And one of our observations is that the folks that are most interested in and just get what we're doing as far as creating the first blood test of fitness are physicians who are CrossFitters themselves, or powerlifters, or marathon runners themselves. And so there's also this new sort of a wave of physicians that are actually working out of gyms, that open up their private practices within gyms. It's called medical fitness, and that's something that I'm really enthusiastic about and excited to see, the combination of all of those things, and having kind of like that infrastructure in place to actually model fitness, but also to direct those interventions right after you've made the diagnosis.
That's great. I'm going to give you two options for a hard question. So either the present or the future. You can pick your poison there. So we said a lot about how proactive care is the way forward, which I really love, that perhaps it's not about top of license care, but what can we do before someone is sick? Whether they're at the gym, if they're eating well, if they're taking care of themselves, they find their community. Those are all things that have been said today. But we also have noted that the structural components of our ecosystem don't facilitate that. So what would either be one structural move right now, policy, infrastructure, and incentive, that you see as viable to push proactive health forward, or what do you think that will look like in 20 years, whichever you think you'd like to answer?
Well, I think self-care should be taught. I think, whether it's in high school, I actually think, incoming freshmen is a nice sweet spot just to educate college students that are leaving mother's nest for the first time. They're essentially building their own lifestyle habits with their peers. Just teach them the importance of a healthy lifestyle, how good sleep can improve your grades or your relationships or whatever it is that student cares about. And we know the Yale happiness class took off, and now there's other replicas, but whatever federal funding or state level funding could be there to support that and just make it a more ubiquitous experience for, again, high school, college, maybe even earlier.
I'm going to go to the future. So 20 years from now, it's going to be dystopian. So I think we will have an AI coach. I mean, even getting the Fitbit Air recently, it goes further than the Whoop and Aura, even though I'm friends with both companies. It, for example, tells you the temperature outside, you should go for a run. It's by no means perfect with the Gemini model, but I think in 20 years, you will have an AI coach which will override every decision you make, but you will still have human preference on what decision you'll make in terms of nutrition, exercise, sleep, but it'll help optimize every decision and then give you the next best action. Just-in-time adaptive interventions, good papers on that. So I really think with the Meta glasses, you'll be walking around, know what nutrition you've had. And it's not controlling your life, but it's just giving you the education and the information for you to make that choice. And I think that's what happens when it comes to behavioral science. In the moment, and we talked about BJ Fogg's model, Royan and I, on a podcast 7 years ago. It really depends in the time you're making a health decision, how motivated you are. So I think you can also work out your preferences, what motivates you. Is it a family member? Is it a text from a family member? Is it competition like Hyrox? Everyone is different. So I think you'll have all the biomarkers like your genetics and blood tests and biomarkers, but then it'll help you really make sense of that without you doing the cognitive load.
It's a bit of a departure from what I've been talking about earlier, but in 20 years, I really hope that there is no more segmentation between mental health and physical health, and we see that they are both impacting all sides and all points of your body. And to that same point, that not just services that are meant to help your physical health, like physicians, but listen, I'm a microsurgeon. If someone has gone through a traumatic accident and I have reattached their hand, do you know who one of the most important person that they will meet in the hospital? It is the social worker. Okay, so we need to be providing these support systems that are not just supporting the physical health, but also the mental health.
All right, I'm going to go wild here. I think we should stop gatekeeping medicine. And in many ways, consumerization, of course, pulling out of the insurance gated system. But I also kind of agree with this wild idea of not blocking most medications with prescriptions. So the first time I heard this idea, and it's from the no longer FDA chief, but I thought it was crazy, like everyone probably thinks I am right now. But then I remember, I'm from Taiwan, and that's how most medications are. You can go to the pharmacy, tell them what's up, and they will give you the medication. Of course, not the same case for like controlled substances or addiction sort of substances, but I think that people are really smart and are able to figure out what's good for them. And we sell lots of very dangerous things over the counter now, like alcohol, tobacco, guns, chainsaws. And so like, what's wrong with giving people access to like their blood pressure medication more easily? So that's what I think should happen. And I think as a part of that, we need to educate people with medical literacy. We talk about financial literacy so that people can get ahead in that way. I think medicine and healthcare is exactly the same. We need better critical judgment, more understanding of the scientific method, and we should just, not gatekeep access.
Cool, Hillary. I love that. From a BioHealth perspective, I want to see a world where fitness is medicine, where food is medicine, where that's the first line of treatment that people are given, way upstream of disease. So a world where there is fitness literacy, as you said, medical literacy. There is food literacy, not just nutrition, right? Because nutrients come from food, right? They're not just isolated in the cloud. We eat and we chew, and where it's all integrated within our communities. But even more than that, I used to work in vertical farming. So I used to grow food with no sun and no soil. Different conversation for a different day. But the reason I did that is because our food system is completely broken. Our agriculture system is broken. I grew up in South Brooklyn in the inner city. Our streets aren't safe for exercise. So if our streets aren't safe for exercise, if we don't have access to healthy whole foods, then it doesn't actually matter. Everything that we're talking about is theoretical. So for me personally, selfishly, I would like a world where we have safe streets where kids can run. We have a lot of green space where communities can actually be outside and be in the sunshine, get their photons and all that good stuff. So.
I love that. I think it's also the first time I heard chainsaws discussed at a healthcare event. I love it. And I think that's a great way to conclude. I moved to New York for my master's in public health like 14 years ago because of my interest in access to all those things. And why was it so hard to be healthy? Why is it still so hard? And then I never even knew what tech was or product management was. And my mind blew up when I realized digital could be that bridge to create that access between the resources in the real world and the people who need them. And I think you're all a fantastic vision for what that future can be. So I do want to give you a round of applause. We'll do that first. If there are 3 of you with burning questions that you want to ask the group while we're here before we break for networking, I will let your 3 burning questions be asked to the panel. She jumped, so.
I jumped. Thank you. I am a clinician by trade. I work in eating disorders specifically. So we see a lot of our patients become overly dependent on data as well as taking it in a rigid way. And so I guess my question is your thoughts about how we can ensure clinical rigor isn't sacrificed when we scale access and prevention. I do a lot of preventative work as well, specifically in eating disorders, and especially with a lot of the talk of wellness and longevity. It's really, really easily taken in an unhealthy way. So would love to hear your thoughts on that as leaders in the field.
I mean, we have to be rigorous, right? So if we're going to, prescribe it or we're going to indicate the software for a certain use case, it has to be studied, just like you would a medication, and that's the level of rigor at least we're aspiring to. So we have a prospective RCT at UC San Diego using our software for mental health outcomes.
So I'm an internal medicine physician. My question is for you, Alina. It's in the biomarker space, how do you solve that problem of correlation versus causation? Because in medical history, we have a lot of biomarkers like homocysteine, HDL, that we tried targeting. We thought because they predicted bad outcomes that if we lowered them, that we would have better outcomes, and they didn't help in the end. How do you get around that problem?
Yeah, definitely. So cardiorespiratory fitness, I'll start with I'll talk about VO2 max. For those who might not be familiar with VO2 max, it's the maximum amount of oxygen that your body can take in its max exertion. And there's tons and tons of literature on the importance of VO2 max, not just for measuring performance and performance capacity. So it's the number one predictor of high rocks success, as an example. But it's also the best measurement that we have of long-term health, chronic disease risk, and all-cause mortality. It's just not being measured at scale anywhere, and there's no limit to it. So it's a metametric. It doesn't just measure one thing, right? It's not measuring one protein or one indication. It's measuring how the body functions as a whole, how your heart functions, your lungs, your muscles, your blood vessels, even your brain. And so when you're measuring VO2 max, as an example, as a proxy for cardiorespiratory fitness, then by improving VO2 max, you're actually improving many, many other biomarkers at the same time. And so it's the most researched metametric that we currently have. So I agree with you. We actually have the same philosophy at VO Health. We're trying to minimize measuring absolutely everything and trying to focus on just the measurements that matter for the most people over time, that are going to decline no matter what as we age.
Is there one more burning question, or are you more burning to talk to each other? One more. His hand has been up.
Yeah, I had a really quick question in terms of, you sort of talked about collecting all of the biomarkers, correct? But I guess when it comes to the security and compliance of actually collecting all of that data, how do you guys manage what data is actually important to actually collect versus sort of are you just collecting data to collect data and then to potentially selling that off?
I can answer on our platform. For us, it's most important the transparency of collecting data. So when people log on to Takeaway, they have the option to opt into community research. So they are actively and transparently really donating their data in a de-identified and aggregated manner for us to learn, and we partner with the University of Oklahoma School of Data Science, so that that is our trusted partner. And to me, it's mostly about the transparency more than anything. There's a company called Evvy, EVVY, and they measure the vaginal microbiome. When they asked their users if they would be willing to share their data, they had 98% compliance. So it's more about, I think, asking and not assuming that we own this data, and being as transparent as possible.
I love that. I think that's a great way to conclude this panel. We're doing things for patients. We want to ask them. We want to increase that literacy. We want to build that community towards this future of proactive health. So one more round of applause for them and for you for building this community. You're all part of it. So we hope you all get to meet each other while you're here.